Hi, my name is Amelia Leibensperger. This is my presentation on demonstration and return demonstration style of instruction in teaching and learning, specifically for the healthcare setting. Start off, what is demonstration? Essentially, demonstration is a type of instructional method of teaching in which the learner is shown by the teacher how to perform a particular psychomotor skill, according to Bastable and colleagues. This teaching method is excellent for teaching psychomotor domain skills, but may also be used to enhance cognitive and/or affective learning as well. This is an engaging instructional method as learners are stimulated visually, audibly, and through their sense of touch by the instructor performing the task with the same equipment the learner will then utilize to perform the task. Check out the following hand washing video for an example of teaching through demonstration. The second part of demonstration and return demonstration teaching and learning is the return demonstration portion. Return demonstration, on the other hand, is an instructional method by which the learner attempts to perform a psychomotor skill with cues or prompting as needed from the teacher. Cues from the teacher during this process may be given, an act known as coaching, and after multiple attempts and coaching if necessary, the learner will achieve competency by performing the task or skill to the satisfaction of the teacher without any cues being given. The method can also be incorporated into a newer concept used widely in the healthcare setting known as teach-back, which helps nurses and other healthcare providers determine how well a patient understands the information they were given or a skill that was demonstrated, such as self-administration of insulin for type 1 diabetic patients. You can see how this patient's return demonstration is a way for the teacher to evaluate the patient's understanding of how to perform certain skills with this clip from the popular medical show House MD.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you have to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Jerk. What was that all about?
She's making chicken recipes.
So after watching those two videos, you can clearly see that the video on hand washing was much more effective in the teaching format than the patient's return demonstration example in the house clip. The hand washing video was so effective because they followed a certain set of steps to provide that effective demonstration teaching experience for the learners. In order to produce an effective demonstration, the teacher should first explain to the learners the purpose of the skill or task that will be demonstrated and why it is important. This will help to identify the learner's effective domain of learning, illustrated why they should be motivated to learn on how to perform the task. Why is the task worth it to learn to the learner? Second, the teacher should review the steps to perform the task in sequential order, taking time to reiterate to the learners why each step needs to be performed in a certain order or manner to help prevent bad habits from forming during the learning process. After reviewing the steps in the process, the teacher should then review the necessary equipment for the task. It is extremely important to make sure all equipment is working properly prior to giving a demonstration, so as not to detract any attention away from the demonstration. Also, having the same equipment available for each learner to palpate and see in front of them before or during the presentation is also useful, especially for learners who are more kinesthetic or visually oriented. In addition, this method also helps to reduce anxiety associated with the return demonstration, as the learners are then familiar with the equipment that they need to use and how it's operated during the return demonstration. Next, the instructor should discuss the expected actions of the learner, establishing clear objectives and definitions of what the learner is expected to do during performance of the skill, so the learner is aware of what they should focus on during their return demonstration. Finally, perform the demonstration, once the whole way through with no interruption, another time with explanation of each step as it occurs, and a third or fourth with exaggerated motions to re-emphasize certain psychomotor skills. Following the demonstration, then have a volunteer attempt to perform the skill if working within a group. If not, go straight into the learner's return demonstration, as according to Bastable and colleagues, return demonstration should occur as closely to the demonstration as possible to be most effective as a teaching method. So there's several more tips for effective demonstration and return demonstration style of instruction. They include scaffolding, coaching, equipment utilization, no side chatter, establish rapport with the learner, praise, and practice, practice, practice. So the first of those tips is scaffolding. Scaffolding is the process of breaking up lengthy procedures into smaller, shorter steps that provides the learner with a clear idea of each stage involved in that portion of skill development. For example, scaffolding is an excellent way to break up the steps to starting an IV, which is a skill required in the process of tagging a patient's blood for a GI bleeding scan in nuclear medicine. Without being able to successfully start an IV, a new technologist will find it next to impossible to tag the patient's blood in order to perform the exam, because there's no way that they can get blood out of a patient that doesn't have a working IV in place. The second tip is coaching, and we already kind of discussed coaching in the prior section, but during the learner's attempt at return demonstration of a skill or task, the instructor should remain silent except when offering cues when necessary or briefly answering questions, according to Bastable and colleagues. When practicing the skill for the first few times, the learner may use pictures to prompt them or be coached by a partner with a checklist of the steps necessary to perform the task. As the learner becomes more confident in the skill they are learning to perform, coaching will not be necessary on part of the instructor, and it actually can be a detriment to the learner's process. Equipment is the next tip for effective demonstration and return demonstration instruction. Research has shown that it is highly beneficial to utilize the exact equipment the learner is expected to use in their normal setting. In regards to patients, this could be a certain type of insulin injector, a walker, a wheelchair, a hearing aid, and so on. For coworkers, it could be a certain type of IV catheter, imaging equipment, computer program, and so on. Frequently, especially with patients, the learner is too inexperienced to transfer a skill pattern from one type of device to another, resulting in a failure to perform the task or skill if they aren't able to use the equipment that they're used to using. No side chatter. This is another really important tip for teachers as they use a demonstration and return demonstration method of instruction. Instructors need to focus their attention on evaluating how the learner is performing the task or skill to truly identify if the learner is competent in performing the task, skill, or not. When the instructor is involved in side conversation with the learner or others, their attention is not fully on the learner, and as a result, they may miss mistakes the learner is making, allowing their teachable moment to pass unnoticed. Asking questions during return demonstration should also be avoided, as they only interrupt the learner who is trying hard to mentally rehearse and memorize the procedure while performing it. Establishing a good rapport with the learner is also another really effective strategy the teacher can use during demonstration. Often learners view a return demonstration as an audition or a test, especially if a good amount of time has passed between the instructor's initial demonstration and the learner's return demonstration. In order to reduce the performance anxiety associated with such a task, it is important to establish a good rapport with the learner and establish their role as a coach, not an evaluator at that point in time. Bastable and colleagues also recommend that stressing the fact the initial performance will not be perfect is also important to reducing anxiety. In fact, several instructors can also use humor when correcting mistakes, either on their own during the demonstration or the first few times that the learners are trying to practice their return demonstration. This can often lighten the mood, again, reducing anxiety and helping establish a better rapport between the teacher and the learner. Praise and practice are the last two tips. These kind of go hand in hand to make a really effective teaching session out of demonstration and return demonstration. Praising the learner when they perform an especially tricky step of a task correctly or throughout their return demonstration also serves as positive encouragement, reduces anxiety, and reinforces behaviors. This provides the learner with the tools they need to be confident and successful when performing the task on their own in the future. In addition to praise, practice makes perfect, especially as different learners need different amounts of time and practice to become competent in performing a task. So moving on, domains of learning, which are psychomotor, cognitive, and affective, all relate to demonstration and return demonstration style of teaching. The psychomotor domain of learning is the majority in the situation of demonstration and return demonstration learning. This domain of learning involves fine and/or gross motor skills in order to perform tasks like venipuncture, administering insulin, even on how to operate a fire extinguisher. This form of health education is based on learning through observation. There is a difference between knowing how to do something and actually being able to do it. Again, that reinforces the idea that demonstration and return demonstration is a very much psychomotor type of learning. And the aim of a demonstration is to help learners become able to do the skills themselves, not just know how to do them. But again, there is also cognitive and affective domains of learning involved in demonstration and return demonstration. It appeals to our psycho domain of learning as it generally is used to teach others how to perform a task. As the Iowa Healthcare Collaborative mentioned in their presentation on patient-centered education through teach-back methods, we remember 10% of what we read, 20% of what we hear, 30% of what we see, 50% of what we see and hear, 80% of what we say, and 90% of what we say and apply. So just looking at those statistics, demonstrating a task and then being able to explain the task and demonstrate it back to the instructor again successfully really goes to show that that information has been processed and able to be applied by the learner. This type of instructional method also applies to all three learning domains. First, to the psychomotor and task performance and practice of the skill. Second, to the cognitive domain and the learner's ability to synthesize the information being presented by the instructor and apply it to the handling of the equipment needed to do the task as the application level of cognitive behavior. And finally, it applies to the affective domain in determining the worth of the skill being demonstrated. Demonstration and return demonstration in the psychomotor domain of learning is evident through activities learned like venipuncture, insulin administration, safe transfer of a patient who needs to utilize a walker. So using the walker from the bathroom to their bed or the bed to the couch and so on. The cognitive domain and demonstration and return demonstration, it's evident in somebody being able to utilize their knowledge of the human anatomy to correctly identify a good spot where a vein is to start an IV, and then apply the skills they learned of how to start an IV utilizing that knowledge. And finally, the affective domain of learning in association to demonstration and return demonstration is, how valuable is the skill to the patient? Why is it worth learning the skill? So if somebody is a type 1 diabetic, in order for them to control their blood sugars on their own and stay out of the hospital, then they have to learn how to correctly self-administer insulin. If they don't want to be in the hospital, then they will be motivated to learn that skill. So there are several advantages to this style of teaching, especially in skills learning and performance. This is because of demonstration and return demonstration actively engages the learner through the handling of equipment used in the task, watching the instructor verbally explain and physically demonstrate the task, and allowing time for hands-on practice and repetition of the task with coaching from the instructor until competence in task performance is achieved. The constant reinforcement of the motions associated with the task increases the learner's confidence, competence, and skill retention, so it very much becomes like riding a bicycle. There are also several kind of drawbacks or disadvantages to this style of teaching. One of the main ones is the time involved. It takes time to be able to set up a demonstration with all the equipment necessary, demonstrate the task or skill to the learners, and then allow the learners enough time to practice the skill through return demonstration and have enough time to coach them before evaluating the learners on that skill. There's also disadvantages to it because you need small groups, or rather one-on-one instruction for this type of teaching to be most effective. Again, that's not really something that's easy to be achieved in certain settings. Equipment also is necessary. If you don't have enough types of spare IVs lying around to teach a whole class how to do venipuncture, then you'll have to come up with another solution on how to properly teach that skill. Again, if you're using more expensive equipment, it can be pretty costly in the learning process, as things do get broken if they're used improperly. And finally, that all equates down to the cost of this type of teaching. It's very costly because of the time needed, the small groups for instruction, and the equipment that's necessary to be able to successfully provide a demonstration and return demonstration style of learning. Finally, there are several examples of this style of learning in the patient population, your peers, and in the general community or different communities of learners. So for patients, this style of learning could be utilized on how to correctly perform various self-care procedures during discharge teaching of patients with teach-back added in. Again, insulin administration for type 1 diabetics, wound care at home, how to care for a PICC line at home if somebody needs to be on long-term antibiotics, how to safely transfer with a walker if somebody is a falls precaution patient. There's a multitude of small skills that patients might not know how to do on their own, but with effective demonstration and return demonstration and the patient's acknowledgement of their understanding of the information and the skill through teach-back, this can be a very effective form of communication and education in the patient population. And since we've mentioned teach-back several times, just a better definition of it, teach-back is a simple mechanism by which a patient's understanding of a concept or topic may be assessed. In other words, you want the patient to restate or teach back to you, the teacher, what he or she is supposed to know. It can be used for teaching concepts as well as skills and techniques. For peers, this can be used in the workplace as students, coworkers in an office, all sorts. Help with peer education during the clinical setting. In my nuclear medicine program, we frequently use demonstration and return demonstration when learning a new skill like venipuncture or how to perform a certain imaging exam. This style of teaching then was taken a step farther in a study that was conducted by Avalon and Cantwell in 2016 on how to close the gap of recurrent readmissions for heart failure patients. And they found that nurses were not as well versed in heart failure self-management education skills as they needed to be in order to reduce these readmissions, as that's a major patient population to have very frequent readmissions when they are not properly taking care of themselves at home and their heart failure gets exacerbated, they land back in the hospital, they get better in the hospital, they go home, they come back. It's a never-ending cycle. In order to break this cycle, this study was trying to figure out how can we effectively teach nurses how to better educate patients on those skills by first educating the nurses on the skills and then using methods like teach-back to, properly educate the patients in a way that's going to stick, so that way they can break that cycle of readmission for heart failure. The study used fourth-year nursing students to peer teach second-year nursing students through demonstration and return demonstration of the teach-back style of education, so the students could learn how to effectively communicate the education and skills that heart failure patients need to be successful at for self-management at home. After their peer teaching intervention, the students demonstrated they understood and remembered the essential knowledge and skills needed to communicate the information effectively with their heart failure patients. And then using that method again of the teach back to the patients between the patients and the student nurses, the patients then could be assessed as to how well they were paying attention to the education provided by the students. And again, it was more of a reflection on the nursing students themselves as how effective of teachers they were in communicating that information and skill sets to the patients. Finally, demonstration and return demonstration can be used in various communities within the healthcare setting through competency assessments for nursing students. Same thing for the nuclear medicine clinical schooling I went through. We had to perform competencies on a variety of tasks, including venipuncture, any type of imaging exam we had to perform. We had to be assessed as to how competent we were in order to pass and sit for the board exams. Same thing is applicable to my current workplace. We have to complete annual CBL, which help show our continuing education and knowledge of certain protocols, like, if a fire happens in the hospital, what do we have to do? If there's an active shooter, what do we have to do? And the same thing for CPR recertification for healthcare professionals. An instructor either demonstrates in person or through a video how to perform CPR. You get to practice it, and then again, you show the instructor through return demonstration how to perform the CPR, and you're then assessed on that skill. Thank you for watching this presentation, and you will then find the references for the presentation listed on the next slide.